Hey everyone, it's Raheel. May is Mental Health Awareness Month, and while we have access to a lot of tools to help with mental health here in Houston, there's still a shortage of professionals in the field. Can a new school of behavioral health sciences help change that and also address where the city falls short for mental health help for Houstonians? Joining me today is Professor and Chairman of Psychiatry and Behavioral Sciences at the University of Texas Health Science Center at Houston, Dr. Jair Soares. It's Monday, May 8th. I'm Raheel Ramzanali, and here's what Houston's talking about. Dr. Soares, welcome into CityCast Houston. How are you?
I'm doing well. Thanks for having me.
Yeah, absolutely. Excited to chat with you. It's Mental Health Awareness Month. Are you celebrating with something special, or is every month Mental Health Awareness Month for you?
Yeah, every day should be a Mental Health Awareness Day. You know, those problems are everywhere, and they need more attention. It is very nice to have a month, where we specifically celebrate that, increase the awareness, and helps our communities understand more what it is that these things are about and how we can detect them and what is it that we can do to best help folks who are struggling with such issues.
Yeah, absolutely. That's such an important thing. And one of the new things that could be coming to Houston here pretty soon is a new mental health behavioral training school, correct? Tell me about that.
Yeah, it is the new UTHealth Houston School of Behavioral Health Sciences. This is going to be school number 7 under the University of Texas Health Science Center at Houston umbrella. We are very excited about that because it will bring together in a very interdisciplinary fashion, all the different constituencies and professionals that we need to have represented, to best understand these problems and treat patients that suffer from these problems, advocate for more resources with the community. A big focus here will be to train more professionals across these several disciplines. And pretty much wherever you look, we don't have enough professionals, who properly trained with expertise to help the many patients who suffer from these issues and their families. So we need to step up the effort. And the plan to put this at UTHealth Houston makes a lot of sense because we have a very large clinical operation already, built in. We operate 2 large academic psychiatric hospitals with a total of 538 beds. They are located side by side. The 2 combined as a complex actually comprise the largest academic psychiatric, inpatient facility in our country. So those are great grounds to train people. We are also at more than 30 community locations, community clinics that we staff under University of Texas physicians with our providers. So we really have the clinical settings that would be, really optimal to train folks in an environment that is also research strong.
So correct me if I'm wrong, because from the outside looking in, right, and just me being just a normal person, right, I'm watching TV and I see ads for mental health apps. I always feel like we're having more of a conversation about mental health and it's so much easier to get access, but we're still in a shortage right now for professionals who are trained, right?
Oh, totally. Wherever you look, it's very acute here in Texas, but pretty much everywhere else in our nation where you look. I mean, we need more psychiatrists, child psychiatrists in particular. We don't have nearly enough psychologists. Psychiatric nurses are in very high demand. It's counselors, master's level social workers. We really need to step up the effort. We were already shortage specialties before the pandemic, and the pandemic made these needs more acute because, more folks were diagnosed with these issues through the stress of the pandemic. Folks who had them before, suddenly weren't doing all that well through the isolation and all the stress and all. Things are gradually coming back, more to a normal now. But the years of the pandemic certainly made the mental health needs of our communities more acute.
So when the new school is up and running, how long is that going to be, and how long before the first graduates of that school can help out the Houston community?
It's a major endeavor to launch a new school like this. So the next 2 years will involve a lot of diligent but yet quote unquote silent work to actually get these different degree programs approved by the proper bodies. In our case here in Texas is the Texas Coordinating Board for Higher Education. So our faculty at UTHealth Houston, we are already very involved in this endeavor, identifying the specific leads across these different areas and disciplines, and to go through the steps needed for approval of the specific degree programs. The school as an entity was already approved by the Board of Regents of the University of Texas, as well as the Texas Coordinating Board for Higher Education. But now we need to, fill the specific boxes, in this larger box, which is the new school. It's going to be a lot of fun, but it is a major undertaking that will take a very committed team like ours, as well as investment from our state and philanthropy. Those two have to come together. Our state representatives and community representatives coming, behind this idea, helping us successfully advocate for funds from our state, to ramp it up, and also continue to draw onto this enterprise here. We've advanced quite a bit in oncology over the past 30, 40 years, and those improvements have really transformed the outcomes. We have so many better ways to treat and a better understanding as to how we have to diagnose early. The field of mental health is still lagging behind. It will take an effort similar to what we've seen in the field of oncology over the past 3 decades, where philanthropists will come to help, states, federal government, will understand the importance and step up the investment. We are seeing that already, and it's very reassuring and rewarding.
So how is that going right now specifically for the school? Because nothing in life is free, and I know state funding is going to be big. You mentioned the philanthropy and private funding as well, but specifically for the school, how is that going?
Well, it's always a game of doing the best that we can to advocate for that and bringing to the table, all the friends that UTHealth has and UTHealth Behavioral Sciences has. But the outcome is uncertain. It's we're only going to know once this is wrapped up. And obviously, like anything else, people have many more good ideas and needs and things they want to do than there is actually money to do them. So it will involve a process of, I guess, our state prioritizing, this project over others where they could invest in. And it takes a village. It takes a lot of advocacy. We have a very strong team here with our leadership, and we are doing the best that we can to advocate for that. And we've been really well received by, many of our state representatives. And, people are passionate about this. They're excited about it. We will have to see, if that will get us through the finish line for this particular cycle. You may or may not know this, but the Texas legislature meets every 2 years. And then people will be, advocating for a variety of different things. And honestly, they are probably all good things. I don't think there is anything that is, that is not worthy there. But I always gotta be able to draw, more passion and more excitement where they would pick this idea over others. And that would allow us to really get this done a lot faster than if in a situation where the investment is more modest. So that's the part, that the state, the support that we need from the state, being a state institution. The other part is also philanthropy. Usually one strong philanthropist that has a vision and a passion comes to the table, and that makes it more likely that the next one will come. And folks often will reach out to their circle of friends and, people, like-minded people that also may have the means to help. So that's the process there. It takes a lot of work and advocacy. We are really well positioned. The proof will be in the pudding. We will see. You ask me again in 2 months, and we will see how far we've gone. We're not going to give up. I mean, this is going to get done, and it will be very special. The pace will be dictated by our success with the state resources to fully launch it, and the philanthropic resources that need to come to supplement the effort.
Do you think the shortage and the lack of mental health professionals would be as wide if there was more of a passion and more of a caring aspect from the state level and even on the city level? Like, would we be in this position?
No, I think those folks have been great. Our state, our representatives, our governor and all of our leadership, they've stepped up in a major way the past several years now to invest in behavioral health in our state. A proof is the hospital. We built a brand new hospital in Houston, attending to a major need that our community had. And it cost $125 million. The state invested there. They are also investing in either renovating or building new facilities in other parts of the state. The state has also invested in what's called the Texas Childhood Mental Health Consortium, where, it's a substantial investment that allows several academic institutions across the state to come together and do a few things. I mean, one is to provide a consultation line to pediatricians. Pediatricians see these problems all the time, and they may lack the confidence and the training to deal with them. So them having the ability to consult a child psychiatrist who can then guide them and, participate in the care as a consultant, that's really important. Then going to the schools, the various school systems, work with the teachers, the counselors to train them on how to best recognize these issues. And then once we do set screening that needs to be done, link the kids that need help with telehealth services, which is really kind of like the most viable way to do this now, considering that there is a shortage, and the shortage is more acute in farther away parts of the state. Larger metropolitan areas like us, Dallas, it's easier than it is in rural parts of the state. But we can bring services through telehealth as an equalizer, even here, many of my patients, once they tried the telehealth through the pandemic years, they like. So unless they're having a true crisis, they may like the convenience of doing a well check or a visit from their home. So that has given us some, really new weapons.
Just one of the many benefits of having UT Health down here and so many good resources for mental health. And with the new school, what would that specifically mean for the city of Houston when the school does open up in a couple of years?
Great question. The school will, on due time, we can't do this all from day one, but on due time, we want to have the broadest menu you will find anywhere for graduate and postgraduate offerings. Some will be master's programs and doctoral programs across these various disciplines that we were talking about, social work, psychology, nursing. But there will also be certificate programs, not fully degree programs. So coordination with our local community colleges, to provide those kinds of alternatives in training for students who may have an associate's degree or work towards an associate's degree that would improve their work prospects, to work in these different jobs available in behavioral health. One of such is what's called a psychiatry technician. And it does not require a bachelor's degree, but requires the proper training to work collaboratively with the nurses and the psychologists and the psychiatrists to help us best take care of individuals with a major mental illness. So this will have an impact, a big impact for the city, and just by preparing better, the workforce across different levels. And that workforce will work at different points, through this delivery of care system. Some, for example, may end up, working our jails. They, because many folks with mental health needs end up there. So there needs to be a component that, provides the care that those folks need. And so many of these individuals that we will train will work there. Others will work through the state mental health system. So the new school will really, train more people. Currently, the latest numbers that I saw, 1/3 of the beds in the state mental health facilities aren't really functional because there is no staff, And the vast majority of the counties in Texas, don't have, they are way short on child psychiatrists, way short. Yeah. So the numbers are staggering, and it is more acute in the more rural areas or farther away from the larger metropolitan regions. But a school like this can be a nice equalizer, just by training people across the board who will then, go back to fill existing gaps.
All right, Dr. Soares, this sounds amazing. So one last question for you. In the city of Houston right now, where do we currently lack when it comes to mental health programs for those with the most in need or for those with the most need?
It's pretty much wherever you look. We've gotten a major reinforcement with the new hospital that added 264 new beds, to not only to our county, but to the entire region. So that's big reinforcement there. But, if you go talk to folks at the VA, if you go talk to folks who like at the Legacy, which, it's a nonprofit that does very good work in this particular area, pretty much any entity, any partner that has a presence in behavioral health, they will tell you that the lines are way longer than they need to be because the demand is way over what the capacity is, So we need to do better and become, first is to train more people, become more collaborative, but also better at, triaging and directing the most acute folks, the most urgent folks. There is an entity in our region, our local mental health authority here is called the Harris Center for Mental Health and Intellectual Disability. Those guys, play a major role. They serve the most underserved, just like we do at the Harris Psychiatric Center. They are our main partner there for the continuum of care. You ask them, it's better, but we still, the lines are way longer than they need to be, just a supply and demand type of issue.
Here's hoping that those lines do get cut a little bit shorter and more care is provided here in the near future. Dr. Soares, thank you so much for joining us and telling us about the new school. That was Dr. Jair Soares. You can learn more about the proposed school with the link in our show notes. Before we go, we could see a rise in new businesses here in Houston. According to a new survey by Crosswind Media and PR, Americans see H-Town as the best city in Texas to start a new business. Dallas came in second and Austin was third. And overall, 2/3 of those who were surveyed said Texas is a good state to start a new business. Love that positive news for our economy. That will do it for today. I'm Raheel Ramzanali, and I hope you learned something new. I don't want to misspeak and get in trouble.